One thing that has been apparent over the last couple of years is we've made really, I think, tremendous progress in treating patients with relapsed and refractory myeloma. There have been 2 anti-BCMA CAR-T cell products that were approved just over the last couple of years, and so I think those have been shown tremendous efficacy and are really exciting. But there are still issues that limit which patients can get them and whether or not they have a sort of long-term durable response. So among those issues is that the manufacturing time is actually pretty long. So for most BCMA CARs, it's on the order of 6 to 8 weeks before you can get the product back and actually infuse the patient. So a lot of patients can't wait for that. Patients with aggressive disease, they just can't make it that long. And then one other issue is that a lot of patients who do even have a good response to CAR-T cells, they eventually relapse. And so I think figuring out how to overcome that is a big issue. And so that's really where this study design came into play. So it involves basically a novel manufacturing approach to develop a autologous CAR-T cell product that targets BCMA. And this manufacturing approach shortens the manufacturing period down to less than 2 days. So if you think about a much longer 10 to 14 day manufacturing, this is now down to 2 days. And there are 2 big advantages to that. So one is that obviously there's shorter time, so you can get the product back to patients faster. And the second is that those cells are now, they're not growing in a sort of artificial medium ex vivo for multiple days. Instead, they're only there for less than 48 hours. And so we think that will actually preserve some of the T cell properties, and that when they expand, they'll expand in the more natural environment within the patient. And that may have additional benefits in terms of the sort of T cell stemness and function of the product itself.